Welcome to our upper body dysfunction care path. With each of these care paths, there are 4 different components. The first component is get adjusted. Not only does the adjustment clear the nervous system and speed your healing, it also increases the motion of a joint, which will allow the other 3 components of the care path to be more effective. Second component is stretch out tight muscles. Third component is strengthen weak muscles. And lastly, we want to integrate the whole thing together so that we can actually use it on a day-by-day basis. Stretching, there's a couple of guidelines with stretching. We want to make sure that we hold it for 10 seconds. We want to repeat that 3 times. We want to do them twice daily. We want to make sure that the stretch is uncomfortable but not painful. If anything hurts while doing the exercises, please stop immediately. For our doorway pec stretch, what we want to do is make sure that our upper part of our arm is lined up with the fibers of our pec, which run at about 45 degrees to the horizontal. So I'll make sure that the arm is up at 45 degrees as it contacts the doorway. And then we're simply just going to step into the doorway as we feel the muscle engage in our chest and stretch the muscle. Stretching out the neck for a levator stretch. What we simply want to do, put the hand on top of our head and pull our nose toward our opposite armpit. So you feel the stretch from basically the base of the skull all the way down into the top of the neck. For stretching out our rear shoulder, we want the inside of a wall, inside corner of a wall. What we're going to do is bring our back all the way against the back wall, shoulder goes all the way against the side wall. We're going to bring our arm up to 90 degrees, setting our shoulder blade back against the wall back of us, folding our arm over, and just gently placing pressure down. For our child's pose stretch, we're going to be on the ground, reaching out as far as we can in front of us while pushing our bodies backwards, feeling a stretch on our lower back and latissimus muscles. We can bring our hands to the middle to get a further stretch, and then walk them over to the side to focus on stretching one side rather than the other. There's also a couple of guidelines with the strength training exercises. First one, the body part needs to be moving at a cadence of 2-2-4. That's 2 seconds exertion, a 2-second hold at the top, and a 4-second release. The second guideline is that we're doing it once a day for 10 to 20 repetitions for each exercise. For our serratus anterior strengthening exercise, we have a progression. So the first thing we want to do is be standing up against the wall, feet maybe about 6 inches away from the wall, back hiney, shoulders all pressed against the wall, thumbs are out with about 30 degrees of abduction. And what we're going to simply do is lift our arms up, touch the wall in back of us, and back down. If we have no problem with that, then we're going to tuck the thumbs down. That's still relatively easy. We're going to go straight up over top of us. And if we can do that, then we can move into the wall angel part of our exercise. Now for the wall angel, we want our forearm in contact with the wall at all times. So the beginning of the motion is going to be where our forearm starts coming up, which for me is right about here. We want to squeeze our shoulder blades down and together. And where the elbow starts coming, or the forearm starts coming up again, which is right about here, then that's the bottom of the range of motion. So we're coming up, and then we're squeezing our shoulder blades back down. For strengthening our lower trapezius as well as external rotators of the shoulder exercise, what we're going to be doing is laying on our belly. The exercise is called chest up, thumbs out. So while we're on our belly, we want our thumbs pointing down at the floor, and we're going to lift our torso while extending our arms up and out, squeezing our shoulder blades down and back. For our multifidi strengthening exercise, we're going to be in child's pose or similar to child's pose. Down on our knees, we're going to take one of our arms and place the elbow in between our knees, while the other hand's in what would typically be a sit-up position. While resting our ribs on our opposite thigh, we're going to just rotate out and up as high as we can, and then come back down. Remembering to breathe throughout the exercise. For our single leg balance exercise with reach, there's two parts. The first one, we want to be able to balance on one foot for a minute. First, we want to cue the foot that we're going to be standing on so it has a nice high arch, and we want to maintain that arch throughout the full movement. We're going to curl our toes under and then just place our foot down, pressing through the ball of our foot. Now the first part of it is just lifting the opposite foot and trying to maintain the position where you're not leaning too far one way. We want to try to stay in alignment with our hips and shoulders in alignment, leaning as little as possible. Pushing through the bottom of our foot, the ball of our foot. Once we have this position down and we can hold it for a full minute, then we can move into a clock face exercise where we're cueing our foot to maintain that arch, pushing through the ball, and then taking our toe and touching to 12 o'clock, and 11 o'clock, and 10 o'clock, and 9 o'clock, and so on and so forth throughout the whole half of the clock. So from 12 o'clock to 6 o'clock, and then the same thing on the other side from 12 o'clock to 6 o'clock. We want to add challenge to it. We want to do 5 reps in a row around the clock, and then 5 reps in a row along the clock this way as well. For the single leg deadlift with touchdown, we are going to start off the same way as we did with the single leg balance. Cueing the arch in our foot, pushing through the ball of our foot, and simply with the opposite hand, we're going to touch the foot that is down.